The I Am for Bulawayo Fighting COVID-19 Trust is mobilizing resources for hospitals that will be treating COVID-19 patients in Bulawayo and supporting social protection interventions for food insecure families and people living with pre-existing vulnerabilities. The initiative seeks to complement government, donors, and humanitarian agencies' efforts of fighting and mitigating the adverse health and safety and socio-economic impact of COVID-19. Amakhosikazi Media caught up with Reverend Hussein Sibanda, the director of Zimbabwe Christian Alliance and a member of I Am for Bulawayo initiative, who explained the vision and the long-term goals of the initiative.
We want to equip the hospitals. We want to make sure that we have all the medicine that we need in Ekuseni, Zonkruf, UBH, and also Mpilo. We are also concerned as an initiative to make sure that testing is done. All the personal protection equipment that is needed by our medical professionals is there. But also the medical crisis has brought a humanitarian crisis. We need to feed our people. 1 in 4 people need food. We know that already 5 million Zimbabweans needed food aid. But now with this crisis, we have an added group of vulnerable citizens. These are women and men who have been involved in the informal sector. They live from hand to mouth. And what we want to do is to put food on their table so that they will not move out and look for food. And this is so critical because it will prevent the spread of COVID-19. We have to make sure that we put food in the table of those that I need right now. We are doing that. We have 28 distribution points through churches, and we hope to reach 160,000 households. And the key issue is every person that needs food must get it, and this is what we are going to be working for. We are raising awareness as well as we do this, and we will stick to the World Health Organization guidelines of how to distribute food during COVID-19.
According to Reverend Hussein, the initiative also seeks to prioritize women and children when distributing food because they are more vulnerable than men.
Part of our identification process in terms of people that need food has been to prioritize women and children, because we know that men can find a way to hustle and get food. But we have a lot of vulnerable women and children that are at home. So those are our priority. And City Council has given us the list, helped us through their social welfare department. And the methods that we are using to make sure that everyone benefits, first of all, we have to look at the levels of income. And then secondly, we look at whether will this person have an alternative source of income from somewhere. Then we look at the number of people in the household to determine how many people we need to feed. But also we look at alternative sources of income. Do they have anything where they can get food or any other alternative? Then thirdly, we also look to see if are they receiving any aid from anyone, because we know there are areas where there is aid that's being sent through cash transfers being done by some of the NGOs that we partner with. So we have to check and see who is not in that net.
Because of the increasing number of COVID-19 cases that are being recorded in Bulawayo, the I Am for Bulawayo initiative is also working towards reaching people who have been self-isolated and giving them food so that they stay indoors. Reporting for Amakhosikazi Media, I am Marvelous Matswimbo.